Why did my face look like a pillow after cosmetic fillers?
Volume loss is one of the first significant signs of facial aging. As we age, the appearance of full and defined becomes more flat or sunken. Facial volume loss due to aging is caused by loss of bone, muscle, fat, and soft tissue. The application of cosmetic filler is a popular treatment to augment or restore facial volume. But many people find themselves looking soft and pillowy after this type of procedure. I'll discuss different aspects of adding facial volume and how that pillowy look can be avoided. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. In addition to performing all types of surgical procedures, such as facelifts and eye lifts, I perform non-surgical facial volume enhancement procedures every day in my practice. People come in periodically after a facial filler procedure done elsewhere, and they complain about looking soft like a pillow or looking doughy. The volume augmentation does not look firm, and often with some random dimpling in the cheeks. They end up looking bloated rather than defined and youthful. So what causes volume augmentation to result in a pillowy look? It's anatomy, specifically the level and the techniques applied. Most doctors place cosmetic fillers just below the surface of the skin or under the dermis. Fillers are commonly placed in the fat and soft tissue space underneath the dermis and rely on the adjacent and overlying skin to hold them in place. This space has limited ability to maintain the shape of a filler even when precisely placed in the office. It can look good initially, but the filler spreads and creates a doughy look. Some doctors actually intentionally place a larger volume of fillers to balloon the skin to fully fill the potential space in such a way that the cheeks end up looking large and disproportionate. From my perspective, this exaggerated and unnatural appearance makes rational people afraid to consider cheek volume enhancement, in many ways comparable to the fear of having duck lips, like some well-known people in the media. Many doctors who perform these procedures are not surgeons with any experience with working at the level of the bone structure. Early in my career, I worked as a division chief of oculoplastic surgery at a level 1 trauma center and performed surgical reconstruction for facial trauma and tumors routinely. In addition, in my cosmetic practice, I've routinely performed facial implants, which need to be placed directly on the bone. When it comes to facial rejuvenation, what is overlooked by many doctors, particularly dermatologists, is where most of the volume loss from aging is actually occurring. It's at the bone level. A few millimeters of bone loss corresponds with a significant loss of volume. Yet, filler placement is routinely placed just under the skin, which reflects an outside-to-in approach. I approach facial rejuvenation from an inside-to-out approach. By applying my knowledge and experience as a cosmetic and reconstructive surgeon, I place specific fillers at the bone level with minimal trauma to create a more structured and youthful appearance. Essentially applying the principles used in facial implant surgery to the placement of resilient and long-lasting hyaluronic acid fillers at the bone level, usually with minimal to no bruising. Oftentimes I find the results to be superior to what would have been achieved on that same individual if they were to have even a facelift. The facial fat and soft tissue layers now lay over the foundational structure, volume, looking contoured, and is natural and soft to the touch. I routinely let my patients know in consultation that if you've had facial filler done and you're unhappy with the results, as long as the material is a hyaluronic acid filler, such as from the Restylane or Juvederm families of fillers, the results can be reversed with the enzyme hyaluronidase. After the dissolving, I can place the facial fillers in a more anatomic and aesthetic way. Patients can look pretty good right after this procedure, which only takes minutes for the full face, including the chin, jawline, and cheeks. I normally see my patients about 2 weeks after the procedure for follow-up. If your face looks like a pillow after undergoing filler placement, you still can achieve a natural look with structural volumizing at the bone level. Many times, patients blame the filler for their outcome. It's important to see filler as a material just as clay is to a sculptor. It is the sculptor that determines how the sculpture looks, not the clay. As I stated earlier, I often start with patients who have a pillowy look from their previous procedure by first dissolving the filler and starting over with structural volumizing techniques to achieve a more structured, contoured, and natural looking result. I hope you found this information helpful. Thank you for your question.